Chapter 2, Evidence-Based Dental Hygiene Practice. So, the main goal also of a dental hygienist in practice is to improve and maintain the oral health of the patient. So, we want to provide a formalized approach to clinical care in which the clinician, along with the patient, uses the best scientific evidence available to make decisions about clinical treatment options. However, evidence alone is never sufficient to make a clinical decision. So what this means is that we can pull all the scientific evidence that we want into a patient's particular individual needs, into their individual case that they may have, but we still need to take into consideration their need, their wants, their desires, risks versus benefits to their particular case. We can't just have cookie cutter cases. We have certain categories that people, can kind of fit in as far as treatment, but inside those particular categories, there could be all sorts of differences. Okay, so we never just use evidence alone to make a clinical decision. It's part of it. It's not all of it. So I know that for future test questions. So the purpose: to answer clinical questions quickly and efficiently, to identify research-supported best practice interventions that contribute to positive patient outcomes. We always can look up articles by the American Dental Association, the ADA, and the American Dental Hygiene Association, the ADHA. And also to ensure application of the most up-to-date practice interventions in the delivery of care. So this is something, it's health industry. It's ever evolving. There are new things that are found every day in the treatment of some things, okay? So if we are looking up the latest information, we are going to have the most up-to-date practice interventions. This is particularly important when you're out in private practice, because what you're learning right now, there may be, the framework will be the same, I'm sure, but it could be, you may have totally different drugs to interact with a different bacteria in someone's mouth, etc. So you've got to keep up to date. The internet. Let's talk about the internet. People are so sophisticated these days on searching the internet for health information. It never used to be like this. In order to research information, you had to speak to some doctors, go take a class, go do research at the library, but before the internet. But now that the internet has come out, you can research certain illnesses and disease at the drop of a hat. Now, you have to know what are good sites and for health information and what are not. You need to know who sponsors certain sites, because someone can put up something about a particular product that is really awesome, and they look like they are just a normal layperson, and when you come to find out that who backs that certain site is in fact maybe the owners of that particular mouthwash or whatever that they're using. So there are some sites you cannot take verbatim just because you read things on the internet. Like everything on the internet is always true, right? So we have to have evidence-based material that need to come from solid internet sites. And the American Dental Association, the American Dental Hygiene Association, the ASA, the anesthesiologist site is good. There are certain sites that we can get our information from to make sure that we're getting the correct information. So they expect, all of our patients always expect us to know the latest developments in healthcare, and of course they love it when you do know something about whatever it is that they want to discuss, because they can ask you questions and it can help them decide whether they want to purchase a particular thing or do a particular treatment. So one thing that just comes to my mind are different toothbrushes. When Sonicare and Oral-B first came out, there are obvious differences in one goes, brushes one way, and the other brushes, the Oral-B brushes, kind of in a round circular pattern. As time went on, and today, in fact, there's really very little difference between Oral-B and a Sonicare, except for patient preference. If you prefer a rounder brush, then you should go with the Oral-B. If you prefer a brush that goes up and down in a vertical, motion, then you probably would be happy with the Sonicare. But you can purchase either one, and both offer units that have all the bells and whistles. So you can't really say, you'd have to do some, if they want to know which one is the best, you always kind of start out saying, my personal preference is this, not that a particular one is the best. So clinicians are not consistently knowledgeable about new therapies in some practices. So these are differences in practice procedures. They are not, this kind of puts patients off. They expect us to know what's going on, and there may be differences in how one office goes about treatment and what they're going to do first or last and what another office has. There may be inconsistencies between dental hygiene schools teaching and procedures tested by a regional examination for licensure. So we try to maintain everything the same. It's impossible to actually be the same. One school may, you can be 99% correct, but one school maybe really truly believes that something is better than another school. So there's going to be inconsistencies because we're human. So the gap in knowledge of up-to-date care widens the longer time that you are out of school. Right now, you're getting all the latest up-to-date information because as it comes about, then so we hand it over to you. But the thing is that 3 years down the line, 5 years down the line, things change, and you'll have new hygienists coming out of graduating and coming out that will be looking at a few things you do as archaic, and they're the ones that really know what's going on. So we have to keep up to date for our patients and for our credibility. So skills needed for evidence-based dental hygiene. You need to understand the evidence-based practice. There's a variety of tutorials in box 2-2 in your text. 2 would be the second chapter, and then box 2. But it's available on the internet. you need to follow a systematic approach. A systematic approach is something that we do in dental hygiene. In almost everything we do a step-by-step. And instrumentation, we do a systematic approach of what we start scaling first, what part of the mouth we start scaling first, etc. A systematic approach is just really key, because if you follow certain steps, then you're sure not to miss anything than if you just go haphazardly from one step to another with no care of what comes next. So you need to read and understand research. Practice helps recognize reliable versus unreliable internet sites and information publications. Be computer literate. Development of critical thinking is very necessary to be able to evaluate different sites. And embrace self-directed learning. Self-directed learning is something that we all dental hygienists just do. We are self-directed in that if we want to learn about something, we'll find it out. We'll take continuing education courses. There's plenty online that are free. Some you have to pay for, but we usually will find out, and that's how, when you're out of the industry, that's one of the ways you can keep current. And of course, we have to, in our state, have X amount of continuing ed hours for a 2-year period in order to renew your license. So the continuing ed kind of forces us to take these courses. I think most hygienists like to know of new things, but it's getting caught up and busy. It's the thing of like, oh, I want to take the continuing ed course on such and such, and I'm going to next week. It's kind of like the diet that you're always going to start on Monday or Sunday night or whatever. You have all these good intentions, and then life takes over, and then a month has gone by or a month and a half, and all of a sudden you realize you still haven't taken any continuing ed. So that's usually what is at the root of the problem. PICO, P-I-C-O. PICO is something that, it's an acronym. It's a way that we can follow a systematic way to make sure that nothing is left out of our treatments. So asking the right questions is critical to evidence-based dental hygiene decision making. A good researchable question has 4 parts. The first part that it has, when a question that you could need to research, is what kind of a patient, is it a patient problem? Is it patient population? So a P is the very first. What are the most important characteristics of the patient or population? So you write down that. The I stands for intervention. Which main intervention or prognostic factor or exposure is being considered? C is the C in PICO is for comparison. It's like, what is the main alternative? O is outcome. What is the desired outcome, accomplishment, measure, improvement, effect? And so if you, sometimes you can look at questions and see whether you can answer it with evidence-based parts to it. Search for evidence. Google and Wikipedia may lead to some results, but accuracy and unbiased sources can't really be assured. PubMed, Medline, is a search engine that provides great articles and other health-related journals, and you can pretty much trust. The American Dental Association's evidence-based website, they have an actual website. Your National Institute of Health, reliable sites are posted on the wall above the computers. outside of Director Beckerley's office. Her maiden name was Sanchez, by the way. I didn't change this yet. So determine the purpose of the internet site. If you see a site that says .edu and .gov, they're considered reliable sites for education and governmental information. .org indicates a nonprofit organization. You need to understand the mission and purpose of the organization. .com, .biz, and .net tend to be from special interest groups or advertising, possibly for profit. So that is wrap it up for Chapter 2.